If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Gastritis. Gastritis occurs when the lining of the stomach becomes inflamed or swollen. Gastritis can last for only a short time, called acute gastritis. It may also linger for months to years, which is called chronic gastritis. The most common causes of gastritis are certain medicines, such as aspirin, ibuprofen, or naproxen and other similar drugs, heavy alcohol drinking, and infection of the stomach with a bacteria called Helicobacter pylori. Less common causes are autoimmune disorders, such as pernicious anemia, backflow of bile into the stomach, bile reflux, cocaine abuse, eating or drinking caustic or corrosive substances, such as poisons, extreme stress, viral infection, such as cytomegalovirus and herpes simplex virus, which more often will occur in people with a weak immune system, and trauma or a severe sudden illness, such as major surgery, kidney failure, or being placed on a breathing machine, may cause gastritis. How do doctors diagnose gastritis and gastropathy? Your doctor will ask about your medical history, symptoms, and any medicines you take. Your doctor will also perform a physical exam and may order an upper gastrointestinal (GI) endoscopy with biopsies or other tests. Upper GI endoscopy. Upper GI endoscopy is a procedure in which a doctor uses an endoscope, a flexible tube with a camera, to see the lining of your upper GI tract, including your esophagus, stomach, and duodenum. During upper GI endoscopy, a doctor obtains biopsies by passing an instrument through the endoscope to take small pieces of tissue from your stomach lining. A pathologist will examine the tissue with a microscope. Doctors may use upper GI endoscopy to diagnose gastritis or gastropathy, determine the cause, and manage complications. Blood tests. Doctors may use blood tests to check for other causes of gastritis or signs of complications. For a blood test, a healthcare professional will take a blood sample from you and send the sample to a lab. Stool tests. Doctors may use stool tests to check for H. pylori infection and for blood in your stool, a sign of bleeding in your stomach. Urea breath test. Doctors may use a urea breath test to check for H. pylori infection. For the test, you will swallow a capsule, liquid, or pudding that contains urea that is labeled with a special carbon atom. If H. pylori is present, the bacteria will convert the urea into carbon dioxide. After a few minutes, you will breathe into a container, exhaling carbon dioxide. A healthcare professional will test your exhaled breath. If the test detects the labeled carbon atoms, the healthcare professional will confirm an H. pylori infection in your digestive tract. Upper GI series. Doctors may use an upper GI series to check for signs of gastritis or gastropathy. An upper GI series is a procedure in which a doctor uses X-rays and a chalky liquid called barium to view your upper GI tract. How do doctors treat gastritis and gastropathy? Treating gastritis and gastropathy can improve symptoms, if present, and lower your chance of complications. Your doctor will recommend treatments based on the type of gastritis or gastropathy you have and its cause. H. pylori gastritis. Doctors treat Helicobacter pylori, H. pylori, gastritis with a combination of medicines to kill H. pylori bacteria. These medicines most often include 2 or more antibiotics, a proton pump inhibitor, PPI, and, in some cases, bismuth subsalicylate. Your doctor may avoid prescribing antibiotics you've taken in the past, because the H. pylori bacteria may have developed antibiotic resistance to those antibiotics. If you are given medicines, take all doses exactly as your doctor prescribes. If you stop taking your medicine early, some bacteria may survive and reinfect you. In other words, H. pylori bacteria may develop antibiotic resistance. To find out if medicines have worked, your healthcare professional may recommend testing you for H. pylori at least 4 weeks after you have finished taking medicines. If you still have an H. pylori infection, your doctor may prescribe a different combination of antibiotics and other medicines to treat the infection. Making sure that all of the H. pylori bacteria have been killed is important to prevent further complications of the infection. Reactive gastropathy. If long-term use of nonsteroidal anti-inflammatory drugs, NSAIDs, leads to reactive gastropathy, your doctor may recommend that you stop taking NSAIDs, take a lower dose, or take a different medicine for pain. Doctors may also recommend taking a PPI along with NSAIDs to prevent or treat reactive gastropathy and its possible complications. If bile reflux is causing reactive gastropathy, doctors may prescribe Ursodeol, a medicine that contains bile acids and can help heal the stomach lining, or surgery to stop flow of bile into the stomach. Autoimmune gastritis. If you have autoimmune gastritis, your doctor may recommend iron, folic acid, and vitamin B12 supplements to prevent pernicious anemia. If autoimmune gastritis leads to pernicious anemia, doctors may recommend vitamin B12 injections to treat this condition. For safety reasons, talk with your doctor before using dietary supplements, such as vitamins, or any complementary or alternative medicines or medical practices. Acute erosive gastropathy. For patients with severe injuries or critical illness, doctors may prescribe medicines that reduce stomach acid such as PPIs, H2 blockers, or sucralfate, carafate, to prevent or treat stress gastritis. If an irritating substance is causing acute erosive gastropathy, treatment includes removing contact with the substance. Doctors may also prescribe PPIs or H2 blockers to reduce stomach acid. If acute erosive gastropathy causes severe bleeding in the stomach, doctors may treat the bleeding during upper GI endoscopy or with surgery in severe cases. Gastritis or gastropathy due to other causes. To treat gastritis or gastropathy due to other causes, doctors may prescribe medicines to treat the underlying cause or improve symptoms. Doctors may recommend diet changes if gastritis is related to celiac disease or food allergies. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.